The Urgent PC Neuromodulation System is a simple method of delivering percutaneous tibial nerve stimulation, a therapy often referred to as PTNS. The Urgent PC Neuromodulation System is a combination of a reusable stimulator and disposable lead set. The Urgent PC stimulator provides the electrical current that is delivered to the patient during PTNS. The stimulator is powered by a 9-volt battery. Before using the stimulator for the first time, install the battery provided with the stimulator. Remove the battery compartment cover and install the battery. The Urgent PC lead set is designed to deliver the electrical current from the Urgent PC stimulator to the patient. The lead set includes an alcohol pad for cleaning the needle electrode insertion site, 2 slim needle electrodes to deliver the impulses along the patient's tibial nerve, and a lead wire to complete the circuit interface between the stimulator and the needle electrode. Attached to one end of the lead wire is a blue one-way fit stimulator connector. The lead wire splits in two, with a surface electrode on one wire and a needle electrode clip on the other wire. The surface electrode is applied to the base of the patient's foot. The needle electrode clip will connect the lead wire to the needle electrode. The new ergonomic Urgent PC stimulator has been designed for comfort and ease of use. It provides ongoing treatment status during therapy via auditory, tactile, and visual feedback. The Urgent PC's Audible Signals provide feedback regarding user-initiated changes in settings, including powering the device on and off, entering the test and therapy modes, adjusting the current level, and using the stop button to halt treatment. Audible signals are also used to alert the user when the system needs attention. For example, auditory signals alert the user when the treatment session has concluded, when the battery needs to be replaced, or when the stimulator detects an inactive current during test or therapy mode. The stimulator's touchpad controls allow the user to easily manage the stimulator's functions. The raised edges of the buttons, along with the tactile feedback received when pressing a button, help ensure precise control of the system. The system has been designed to prevent against inadvertent status changes by requiring the user to press and hold specific buttons to change modes. The power button is located at the top of the stimulator. This button turns the device on and off. To activate the power or to shut it off, press and hold the power button for 2 seconds. The round yellow, red, and green buttons located in the center of the device provide the means to enter and exit test and therapy modes. The yellow button is used to enter test mode, during which you determine the optimal current setting for therapy mode. Press and hold the test button for 2 seconds to enter test mode. Right above the red stop button is the current adjustment button. The raised portion with the plus symbol is used to increase the current. The raised portion with the minus symbol is used to decrease the current. Current is adjustable in 0.5 milliamp increments from 0 to 9 milliamps, corresponding to levels 0 to 19. At level 0, there is no current flowing through the lead wire. At level 1, the current is 0.15 milliamp. At level 2, the current increases to 0.5 milliamp. Each subsequent level represents a 0.5 milliamp increase in current. Once the optimal current setting for a patient has been determined in test mode, press and hold the green button for 2 seconds to enter therapy mode. Test mode is a prerequisite for therapy mode. This is to ensure that therapy is conducted at the optimal current setting for that patient during that treatment session. A red button signaling stop is located between the yellow test button and the green therapy button. Pressing the red stop button results in immediate termination of the selected mode. For example, if you press the stop button during therapy, therapy will immediately end. Icons and alphanumeric characters on the status screen provide clear visual feedback on the operational status of the stimulator and the progress of the PTNS treatment. The number of horizontal lines displayed in the battery level icon represents the relative remaining battery life. The number of lines will decrease as the battery power is depleted. 7 lines equal a fully charged battery. 1 line indicates a nearly empty battery. A flashing battery indicator with only 1 line remaining indicates that the battery needs to be replaced with a new battery. This icon indicates the functional status of the lead wire. The icon will flash if there is an issue with the lead wire. There are 2 reasons the lead wire status icon may flash. If there is no lead wire attached to the stimulator, the icon will flash. If the lead wire attached to the stimulator is no longer functional, the icon will flash. To resolve this issue, simply insert a new lead wire into the stimulator. When this icon appears on the status screen, it means that current is not flowing through the lead set. As a safety feature, there is no active current when the device is turned on. Consequently, this symbol will be displayed on the status screen after a lead wire has been inserted and before entering test mode. To activate the current, simply enter test mode and adjust the current. If during test or therapy mode, the stimulator displays the inactive current icon, beeps, and resets the current level to 0, this indicates that there may be an incomplete circuit. To resolve, check the security of the connector between the stimulator and the lead set and ensure that the needle electrode clip is securely attached to the needle electrode. This symbol indicates that current is actively flowing through the lead set. In other words, treatment is underway. The selected current setting appears in numeric characters at the center of the screen at all times. The default current setting for test mode is level 0, which indicates that no current is flowing through the device. The treatment status is indicated by visuals in the status screen and by the LEDs. In test mode, the word test appears under the active current icon, and the LED above the test button is illuminated. Once therapy mode has been initiated, a countdown timer appears. This timer indicates the time remaining in the 30-minute therapy session. During therapy mode, the LED above the therapy button is illuminated. At the completion of therapy mode, the word END will appear. To ensure that the stimulator maintains proper working order, it runs self-checks periodically. If an internal fault is detected, therapy mode will end and the service required icon will appear on the screen. If the icon appears at startup, it may be the result of holding down more than one button while powering on the device. In this instance, you may be able to resolve this fault by simply turning off the device, then turning the device on again. If the service required icon appears during treatment, Contact Uroplasty for further instructions. Several tools are available as a reminder of these features. The Instructions for Use booklet accompanying the stimulator contains detailed information on the use of the stimulator and the lead set. A one-page summary guide is also available. Ask your sales representative for more information.